standard aging processes are made worse by not having enough of these substances. We see patients improve their T-score when they start estrogen therapies. Typically, it takes between 6 months and a year. So that's the score that we give somebody when we do a bone scan, for osteoporosis. And the debate is whether that's the gold standard anymore, or whether an ultrasound is better, but that's sort of what everybody looks at. So it reduces our risk pretty significantly, and we can see that on that study. Why does estrogen do that? Well, estrogen does that because there's receptors in the bone-forming cell, the osteoblast, that are activated by estrogen, and then estrogen also suppresses the cells that increase bone turnover. So we can see a statistically significant amount of decreased bone turnover in patients when we start estrogen therapy, even after 65 years old. It also reduces bone pain, so it'll reduce joint pain. Anybody who's ever done hormone replacement therapies on a patient has had them come in with multiple joint complaints. My joints just ache, they feel stiff. I'm not able to do yoga like I wanted to do. I can't bend down and pick up my grandkids. Well, we start them on an anti-inflammatory diet and bioidentical hormone replacement therapies, and 75 to 80% of those symptoms resolve. So we see that because these hormones are good for our joints and good for our muscles and good for our mind. And so as we age, part of the aging process and the acceleration that we see from things like inflammaging and standard aging processes are made worse by not having enough of these substances.